Hi, my name is Dr. Jonathan Mainieri, and this workshop or seminar is talking about weight loss and inflammation. First, I'll be talking through a variety of slides, and then Ali, our acupuncturist, is going to finish off and talk about the program in detail. If you're interested in doing, having a coach for weight loss, she's helped many people over the last 5 years. She's a personal certified trainer. Anyways, so let's get started. The first thing that's so important is going over these 5 factors of health, which does promote healing, obviously nutrition, which we're going to talk about today, lowering inflammation, thus losing weight. The second thing is exercise. What type of exercise? And Ali's going to go through that specifically in the program. What type of exercises is good specifically for your body, because everyone is so different. And then positive mental attitude, right? Keeping a positive mental attitude every day really helps to get you through those difficult dips in this program. The fourth thing is sleep, which is very important because a lot of Americans are not getting enough sleep and their serotonin levels are dropping, increased cortisol levels. So we'll get into that as a little bit as well. The last thing, which is very important, which many of you are already doing, is having a sound nervous system, meaning that your nervous system, through the adjustments that we've been doing, as we free up pressure on the nervous system, usually digestion improves, sleep, less pain, less stiffness. Remember, all of your hormones, every organ and tissue in the body is controlled by your nervous system. So these 5 factors of health are kind of like the spokes on a wheel. So if you have 5 spokes, right, supporting a wheel like a bicycle wheel, then it's going to ride nice and smooth. Now, obviously, if we broke 3 of these spokes on a bicycle wheel, the wheel would collapse. So it's so important that you have equal balance with these 5 factors of health. So you may look at these and say, hey, I'm having some challenges with sleep. I'm having some challenges with nutrition and exercise or stress levels. So really look at this and write down areas that you need, that you're doing well with, and then other areas that you need to put more time into. Okay? So in the United States, how healthy are we? If you look at where we rank out of 42 industrialized nations, health-wise, just 2 decades ago, we ranked 11th for infant mortality and life expectancy. Now, we're ranked 42nd, dead last for infant mortality and life expectancy. Cuba and Jordan are above us. So we're spending all this money, an unbelievable amount of money, and still we're not getting the life expectancy that we expect from that, and infant mortality is very high. So what's happening? We have the best drugs, we have the best surgeons, the best doctors, and we should be living the healthiest lives. We should be living to like 120 for the amount of money that we spend. But check it out. We die 10 times faster from heart disease than all of those other countries, 42 industrialized nations. So we're going to get into why that is happening, why sugar and salt is really the culprit. It's not fat. We are 5% of the world's population in the United States. We consume 60% of the world's medications. So is the path that we're taking, is that really working? Is more medications benefiting us? Well, actually, it shows that it's not. Okay, so just some other stats that you'll say that, of course, cancer, heart disease are some of the top killers, and also things like adverse reactions to medications, errors in hospitals. So what I'm getting at is true health doesn't come from lotions, potions, drugs. True health comes from within. It's what you're doing to your own body. It's your environment that you're creating, okay? And obviously the environment that we're in right now with nutrition and exercise is really lacking. They're talking about having kids, as you can see, 25% at the top there of children age of 5 already have plaquing in their arteries, okay? There's already have high cholesterol plaquing. And we're going to talk about how to lower that.
So in America, 1 out of 10 children now are diagnosed with ADHD. And the average child watches 32 hours per week of TV. Some of these stats are just astounding on the environment that parents are putting their kids in, and what they're putting in their mouths, and what they're allowing them to watch, or in their environment. And these two pictures you'll see on the one on the left, these are actually two esophaguses of a child. Now, one has loaded with yeast, basically yeast infection. One is normal. Now, the one on the right is normal. Obviously, the one on the left is having some issues. And we're finding with kids that there's high amounts of yeast infections, weakened immune systems, hyper-responsive immune system, meaning that they get these. Obviously, back when I was growing up in the 1970s and 80s, there was no peanut-free table. Now the kids are allergic to so much stuff because of GMO, artificial colors, chemicals, cleaning products. So you add all that together, and we have these hyper-responsive immune systems, and it can be deadly for kids. The histamine response that the body's creating is sometimes as much as 10 times higher than it used to be. So we'll talk about things that we can do that you can find out more information. We have some great new allergy testing through ALCAT that test over 100 foods, 25 different environmental chemicals that you can get your kids tested on, and food colorings. It's really awesome, and it's really easy to do. You just come into the office, we give you a prescription, you have your kids go out to a draw center, and like a LabCorp, they draw blood and they send it out to see what their histamine response is to these different environmental toxins, and then we can start to eliminate that. Otherwise, you're just guessing on their healths, you're just giving them this Claritin or other antihistamines, but really, what's the true cause? So it's important to find that out. We're going to talk about some myth busters. The main thing is talking about genetics. We have a lot of patients that talk about genes, and my parents, they both died of cancer. I have cancer runs in my family, so I'm probably going to die that way too. Or, I have high cholesterol gene in my body. I have high cancer gene. I have high, everyone's overweight. So a lot of people tend to blame things on their genes. Genes are only run about 10 to 15% of your health you could blame on your ancestors. 85% really of your health has to do with the environment that you put yourself in. Okay, that means exercise, nutrition, low stress. All right, so this is what happened in Okinawa. They found out that Okinawans who live, their longevity is some of the longest in the world. So meaning that they live the longest, and when they die, they don't die from cancer and heart disease. Okay, so if an Okinawan, you'll see down here in the middle, it says older Okinawans that if they live to over the age of 90, which a lot of them do, less than 1% of those people actually pass away from heart disease and cancer. They just die of old age. They're in a rocking chair, they fall asleep, that's how they go. So many, many, many Okinawans don't actually die from cancer and heart disease. All right, whereas check out the stats. U.S., we have 4 times the number of deaths compared to the Okinawans from lymphoma, heart disease, breast cancer. Now, the research shows that the Okinawans have the same cancer genes that we do, the same heart disease genes that we do, the same, all these genes, they have the same one. It's just what they're finding out, the research is finding out, is they don't turn on those genes because of their environment. Well, what are the Okinawans doing? So they're not turning on the genes. Well, they have an anti-inflammatory diet. They eat a lot of seaweed, green tea, lots of fruits and vegetables, lean protein. Their diet doesn't consist of high amounts of sugar. All right, and that's what we're going to get into. They have low inflammation in their body. And this just goes on to, the genetics, what they call centenarians, people that live beyond 100. Just talking about they have the same genes, and many of them live full 100 years despite bad genes and absence of good ones. So I'm not sure if any of you guys have seen this this magazine, headlines through time. This was a few years ago, The Secret Killer. Inflammation is the cause of heart disease, cancer, and Alzheimer's, and a lot of other degenerative diseases. And we're going to get into that. What is causing inflammation? And you can have a blood test done if you want to. It's called C-reactive protein, which they'll test to see how much inflammation is in your body. It's an important test, so I'd ask your primary doctor to do that. What causes inflammation? Well, there's a variety of causes. Stress, obviously sugar, the ratio of your essential fatty acids, right? If you're eating a lot of omega-6s and 9s compared to your omega-3s, right? Your omega-3s are the most important. That's your olive oil, that's your fish. Your 9s are like your hydrogenated oils, your French fries at McDonald's, right? Also, how about sugar in general, like or chemicals? Like a lot of people drink Diet Coke or Diet Pepsi, all that aspartame, the chemicals in there. A lot of people don't know that aspartame, that's an artificial sweetener. At 88 degrees, it turns to formaldehyde in the body, which is a carcinogen. So removing toxins, removing all those toxins in your food, okay? So you may just look at, day in, day out, what you're putting into your food, into your body, and your kid's body. Because I'll tell you, a lot of parents feed their kids low-performance food, and they expect their kids to perform at a higher level, whether it's school, in sports, just in life. They expect them to sleep well. Well, if you're putting in all these toxic food and chemicals, there's no way that your child's going to perform at their level that they should be. Their brain needs brain food, which is omega-3s. It needs low inflammation foods, salads and greens and fruit and lean proteins. So really be conscious because you're creating a toxic mess. And look at your cleaners. I mean, your shampoos, anything that touches the skin goes into the body. You probably know that they're adding birth control patches, nicotine patches. There's an antidepressant patch. Because anything that touches the skin goes right into the bloodstream and makes the body toxic, okay? So let's move on. As we know with Paula Deen, as you guys know, that she was, she had a show on she had a cooking show, and then she was diagnosed with type 2 diabetes. Remember, that's usually from environmental factors, usually from poor diet, poor exercise. Type 1 is usually from a virus or a genetic defect in the pancreas. So she's got type 2 and she was diagnosed with it. Now she chose to, be a proponent of taking medications for type 2 diabetes. And a lot of people don't know that 80% of type 2 diabetes can be completely reversed with exercise and nutrition without any drugs. So I'm not sure how much she got paid to be the spokesperson for this drug company, but just want to let you know you don't have to. Type 2, you come in, talk to Allie. She'll put you on the right program. You can see some huge changes. We've had many, many, many patients get off with zero medication they're using with type 2 diabetes. Okay, so you don't have to go that route. The United States, a lot of stuff is changing with these hydrogenated oils and the science of food. A lot of food companies hire scientists to make food more addicting, add more chemicals like they did with cigarettes. And this is what's happened since the introduction of hydrogenated oils, high fructose corn syrup, which is the main killer, and some others of these modified sugars, artificial sweeteners, and chemicals. You'll see the red areas, red states are where they had more than 35% of the population was overweight. As we go to 1992, and more people consuming these high fructose corn syrups and chemicals, and as well as their kids, things start to spread, just like a virus would. And then we see hanging in there, we've got Colorado, Utah, Alaska, and Hawaii. And then 2000, every state, more than 35% of the population now is overweight. And so that's what's happened. Like I said, the introduction of diet drinks, diet foods, chemicals, high fructose corn syrup, high amounts of sugar. That's why we're in trouble with heart disease. Now,
Heart disease, what happens when you have high cholesterol? A lot of people thought it was from high-fat food. And the research shows that that wasn't true at all. We got completely duped by this high-fat thing causing high cholesterol. Okay, because for the last 15 years, we've been doing low-fat everything. You look at anything in the store, it says low-fat this, low-fat, low-fat this. So we should have really, because we're consuming less fat now than ever in our history, we should have lower heart disease. Well, I mean, heart disease is skyrocketing still, heart attacks. It's the sugar. It was the sugar all along. What sugar does cause inflammation in the body, and it caused the body to lay down. As a response from inflammation in the arteries, your body lays down plaque to protect the arterial walls. And you get plaquing from sugar, it's not from fat. That's why the French for years ate way more fat than we did. And they have less heart disease, less heart attacks. Okay, so remember it's the sugar and the salt. Now remember, you can't eat bacon fat all day long. Good fats. Good fats are olive oil, coconut oil, avocados, nuts, seeds. So here's an example of an anti-inflammatory diet, and what it did, it actually melted this patient's plaque away. You'll see on the slide that says A, his arteries are all compressed because there's plaque in there. There's barely any blood flowing to these. These are the arteries that go to his heart. Now, after a 6-month anti-inflammatory diet, look at the slide on the right, B. Actually, the cholesterol, the plaque, melted away. His arteries are much thicker. There's a lot more blood supply going to the heart. Okay, and that's the program that Allie's putting patients on here. It's very effective. So when we talk about sugars, well, or inflammation, any of obviously the processed sugar, right? Sugar causes really an increase in blood sugar, grains, so carbohydrates, so breads, people with the Subway breads, anything like that. That any carbohydrate's going to turn into sugar in the body within seconds, and then your body has to release cortisol and insulin as a response to those high blood sugar levels. Okay, and cortisol and insulin, the research found out that there's an enzyme that it increases called PLA2. Now, this enzyme that sugar increases in the body increases inflammation, and it's the cause of 98% of all diseases, especially heart disease. So as you're increasing your sugar, carbohydrates, and salt, you're going to get an increase in these diseases, cancer, right? Alzheimer's, diabetes, arthritis, autoimmune diseases. Okay? So we want to keep the body, as we say, as there's higher inflammation, we have more acidity. The body becomes acid. We actually want to be more alkaline. Now, the normal pH of the body should be about 7.3. All right? That's a normal pH. Right? With acidity, in the 2s is very acidic. So 1 can of Coke or soda has a pH of 2.5. That's 50,000 times more acidic than neutral 7.3. So to dilute that, 1 can of soda, some people say, oh, I'll just drink 1 can of soda a day. Well, to dilute that, you need to drink 30 cups of water to neutralize 1 can of soda. So just remember, if you say, oh, I'm just going to have 1 soda, then good luck. You're going to have to drink 30 cups of water to neutralize that, to bring the balance back to 7.3. Okay? So it's very toxic. I mean, the acidity is high. You could do the experiment if you want. Throw a penny into a soda can and watch it completely dissolve. All right, that's what it's doing to your body, your teeth, and bones. And it's actually causing osteoporosis. And that's what this slide is about. As your body becomes more acidic with the sugar and salt that you're consuming or carbohydrates, it actually is going to start to leach calcium out of the bones. Why? Because your body is always trying to find neutrality. So if you have high acidity, your body says, oh, it's too acidic. We got to buffer that. So it's going to leach calcium out of the bones, and you're actually going to get osteoporosis from high acidity, high inflammation in the body. Okay? So it's a double whammy. It's not only causing the heart disease, all these autoimmune diseases, but it's also causing osteoporosis and causing osteoporotic fractures. And that's what this next slide is. These are osteoporotic fractures.
that are very debilitating, very painful. As you can see, there's one in the middle where it's pushing back into the spinal canal. That's the spinal cord, that gray matter, and the cerebral spinal fluid. So you don't want these. Make sure you're doing your weight-bearing exercise. Keep your inflammation in your body low by eating more anti-inflammatory foods, which we'll get into, and Allie will talk about that. So one anti-inflammatory food is fish oils, okay? Omega-3s are awesome. Make sure you get them high quality, filtered, because you don't want to have mercury in there. But anytime you have back pain, take 2 or 3 omega-3s for a couple days and say, hey, I feel a little bit better, because it's going to lower inflammation in the body, okay? So we talked about alkalinity. We talked about, you want to be around 7.3, 7.4. You don't want to be in the 4s and the extreme levels, the 2. You'll die, actually, if it's that low. So that's the alkalinity is 7.3 and above, and acidity is 7.3 and below, okay? So what's causing, once again, acidity, acid in the body, inflammation? We all know that meats are covered, with bovine growth hormone, antibiotics, salt, sugar. If you look at your ingredients of just sliced meat, you'll see a ton of other ingredients. Try to get it clean. Sprouts or Whole Foods, where they use less toxic ingredients in your meats, okay? Sugar, refined carbohydrates, like we talked, all breads, refined grains, destroys your immune system, okay? Grains turn to sugar in 4 seconds. So as you eat bread, boom, that's why a lot of people feel tired after pasta. Blood sugar is just cranked up. Insulin just cranked up. All right, so dairy. Now remember, dairy does not decrease your risk of osteoporosis. They had to stop, the dairy industry had to stop those commercials that said milk does your body good by reducing osteoporosis. It doesn't. It actually is sugar in there. There's sugar in dairy. Dairy is for baby cows. There's no way the humans were supposed to drink that dairy, because what human is, now a calf is supposed to grow 200 pounds in 1 year. There's no human that is supposed to do that. The closest thing to human milk is goat's milk, all right? So you can have a little bit, but dairy in general, not very little calcium, a little bit of protein and fat. The fat isn't even good because it's completely homogenized and pasteurized, all right? So try to stay away from it. Caffeine, obviously we know what that does to the body. Constricts arteries, reduces serotonin. Salt causes inflammation. Ever eat a really salty food, dish, then your rings are tight? Inflammation, massively. Alcohol causes inflammation. It also increases definitely your rates of colon cancer as well. Tobacco, we know what that does. Artificial sweeteners increase your cravings for carbohydrates by 37%. Any of those diet drinks, okay, and all medications. So some great nutrients if you have high cholesterol in conjunction with an anti-inflammatory diet. These are what we recommend here in the office: EPA, DHA, 2,000 milligrams per day, niacin, chromium, and garlic, okay? So that's a good little formula in conjunction with a very good, healthy anti-inflammatory diet. Now, if you're on any statins, you want to make sure that you're also taking CoQ10 to kill the effects of that. And that's completely up to you, between you and your doctor, if you even want to take the statins, those anti-cholesterol reducing drugs. Now, you have to remember a lot of side effects with those cholesterol reducing drugs. What are you trying to do? Well, I'm trying to reduce cholesterol. Well, the body's producing that for a reason, to protect the arterial walls. So as you reduce cholesterol so low, it actually causes depression in male, reduces testosterone in males, because cholesterol is needed to produce hormones. So we're seeing a lot of our male patients with depression, very low libido. Then they want them to go on a Viagra. Then it starts to affect their liver, and that will increase blood pressure. Now they're going to want them to go on blood pressure medication. So it's this cascading of events that's really not good. Okay, so Allie's going to go into this next portion. She's going to talk about some of the foods to avoid eating and some of the foods to work on. And I would highly recommend you do her. She's got a 90-day program that's amazing. It's helped a lot of our patients. That program, some patients have lost over 100 pounds and are feeling awesome, healthy, and all natural. Okay, so hold on a second, and then Allie's going to start this next portion of the workshop. Talk to you soon.
Okay, so now that Dr. Mainieri has scared you about about some other health issues and about what our food's doing to us and all the scary stuff, we're going to talk about what we can do to change that and how we can become healthier and not have to worry about all these horrible diseases and everything that can happen to us. So throughout this program, I'm going to tell you some different foods to eat, some different foods to avoid that aren't very healthy for us, and just a little bit of an outline of the program that you can sign up to be a part of. So first we're going to talk about the different stuff to avoid. First, we want to avoid commercial meats. They usually are pumped full of hormones, steroids, antibiotics. The animals were raised in very poor conditions, and so the animals themselves aren't healthy at all, and so obviously their bodies are suffering and their meat's not going to be healthy for you to consume either. So we want to buy really clean meat that have no hormones, no steroids, no antibiotics, organic. That's going to be the best meat to have, and you're going to feel much better eating that. Another thing is dairy products. Dairy products really don't have any nutritional benefit to us. I know that we all grew up and have been told that they're really high in calcium and we need that to prevent osteoporosis, but the truth is that that was really just kind of a marketing ploy to get by dairy farmers and the dairy council to get you to consume more dairy, and vegetables have way more dairy than or way more calcium than dairy products, and actually almond milk has more calcium than milk does anyways. So we really want to avoid our dairy products. If you absolutely have to eat dairy products after the first of the 30 days, make sure you get organic dairy. Same thing with the steroids and antibiotics and all that. You don't want to be consuming that. Liquor, all of that. You want to avoid the caffeine, liquor. That stuff is not very good for detoxing and taxes your liver more, so we want to avoid that for the first 30 days also. Soy products. Soy is heavily GMO in this country. That's basically like 98% of our soy products are GMO, and soy, when you put it in your body, is basically just estrogen, and that also taxes your liver and can cause things like breast cancer. So we want to avoid like isolated soy protein, soy supplements, soy protein powder, protein bars, all of those things. The exception here is fermented soy products, which is like tempeh and miso soup. That stuff is better for you, and fermented is kind of a different process in making it, and it also has probiotics, which are good for gut health. So we kind of want to limit even the fermented soy, but if you're going to have soy, that is what we need to do. We want to focus on eating foods in their most natural state. So that would be like foods that don't have any nutritional label because they're just one ingredient. That would be our fruits, our vegetables, our good organic meats. Those products have nothing else in them. Quinoa is that way. Oats are that way. So no ingredient label foods are the best. Otherwise, make sure on your ingredient label that you can pronounce every single ingredient. The ingredient list is very small, and they're all whole foods. So make sure that that's going on in your food. We want to make sure that we're eating fresh organic fruits and vegetables, which frozen is acceptable too. Same thing, Monsanto has completely sprayed pesticides and other chemicals on all of our fruits and vegetables that our body just really has no idea how to process any of these things. All of these additives and chemicals and food colorings and stuff, that's just not what our bodies were made to produce or to do anything with. So we really need to start avoiding some of those chemicals to be in optimal health and have our bodies working right. You wouldn't put bad gas in your car because your car wouldn't run right on it. So we want to do the same thing with our body. Again, we want to be eating good, clean meat and eggs, free-range eggs, organic eggs, same with meat. That's all good. Whole grains. There's always big debates with grains, whether you should be eating low carb, high carb, whole grains, just quinoa and oats and those types of grains, no wheat, gluten-free. It's hard. There's just so much information out there to figure out what to do with grains. So in this program, we are going to be avoiding wheat. We don't want to eat wheat. It's not the same wheat that was produced 30 years ago. It's just not as clean, and our bodies don't do very well with it now. And so we're going to avoid wheat and whole grain, flour and all of that. But we're going to be eating quinoa is fine. Rice products are fine. Try to eat brown rice. It has way more fiber in it. So quinoa, rice, oats are fine also. Oats are no problem. So try to make sure you're just eating those 3 grain products and try to really avoid the flour, wheat, all of those. Nuts and seeds are great. They're great sources of fat, your omega-3s. They keep you full and satiated, so that's good. And then make sure you're drinking tons of water. Another thing that Dr. Mainieri kind of touched on was exercise. So exercise is good for us. We really need to work our bodies out. Our bodies weren't made to be sedentary at all. So if you are completely sedentary right now and just beginning an exercise program, start with walking. Walking is very simple. You need no equipment, no anything. You can just start walking. And so even if you start slowly by exercising just 10 minutes a couple times a day, that's great. And we can build up from there. Ultimately, we want to be getting our heart rate up and actually taxing our body, having that good stress on our body. That's how we grow, and that's what our body's like. So we want to start doing that. And then strength training is also very important. It helps prevent osteoporosis and obviously helps your heart. It's a muscle. So we want to start increasing our weight-bearing exercise as well. So our program for detox, weight loss, getting you healthy is a little bit different than everyone else's in that we are going to be offering acupuncture, oriental medicine, and aromatherapy as part of the program to help you ward off cravings, make your metabolism work more efficiently, and detox your body even more. Acupuncture, when used in conjunction with diet therapy, has been shown to increase metabolic function, promoting the consumption of body fat, resulting in weight loss. That was a study that was completed, and there were several people in this study, and they did it over a month. The people who used acupuncture in conjunction with exercise and eating healthy lost an average of 10 pounds, where the group who didn't combine acupuncture in that and just ate healthy and exercise only lost 3 pounds per month. So acupuncture really works to get your body just functioning better. It helps your metabolism. It helps your digestion. It helps ward off, like I said, the cravings and hunger, make your appetite better. It helps eliminate stress, so that stress eating that you're consuming all those calories from will be helped also. So acupuncture can really complement a weight loss program very nicely. So in the group setting, we're going to do a protocol called NADA, which is a detox protocol, and it's good for lots and lots of different things. Hospitals use it as part of like drug detox from heroin and cocaine and those things, and so it can most certainly detox unhealthy food out of you and get you functioning a little bit better. It also, again, helps the appetite, hunger, cravings, your metabolic system, your endocrine system, your nervous system, helping your stress level. So it really does. It's very calming, and it's a good thing that we do in our ears. So each week we'll come in and we'll do the weight. We'll do some, a few times we'll do the body fat percentage. We'll use the calipers and get measurements and all of that. And then we'll put in the auricular acupuncture. And then we'll just kind of have a support group. We'll talk about a topic relating to healthy living, whether that's diet, exercise, stress relief, something related to that. We'll have a topic, and then we'll talk about some different stories, and you guys can talk to each other about what you're going through with the group and everything, and it'll just be a nice supportive group. Everyone need some support when they start a new endeavor, and this is definitely one. You're completely going to change the way you think and eat and your taste buds and your view toward food, which is all for a positive thing. But with that said, there's obviously going to be difficult times when you're at events or when you have kids or other situations where it's going to be a little bit more willpower required. So, hopefully after the first 30 days that's gone and you've learned that you feel better eating this new way, and you won't have the desire to eat food like that anymore. So that's kind of what the group's going to do. The costs for the group. So for the group setting, we're doing it group because it can make it a little bit less expensive for you guys. The auricular acupuncture, we're going to do 8 sessions, so we're going to do 4 the first month for the first 30 days when things are a little bit more difficult, and then we're going to spread them out every 2 weeks for the remainder of the program the next 2 months. And so for 8 sessions of auricular acupuncture with the weight and dietary advice and exercise advice, it's going to be $360, which breaks down to just $45 a session. If you want 8 60-minute completely individualized sessions with acupuncture where we can go over an entire health history and figure out where we need to do herbs and a way more tailored program for yourself, that'll be $65 a session or $520. So for either one of them, you can also choose to pay as you go for either the group or the individualized sessions, and that will just be $85 a session. So that's the investment for this, and I really hope that you guys think about joining us. We need a minimum of 5 people to make this group work, and I think that you'll meet some amazing people along the way and get some good help, and we will all get healthier together. So again, if you guys have any questions or anything, feel free to call the office and we'll answer those questions here. And we hope to see you guys soon. Thanks.